The coronavirus pandemic is shining a spotlight on disparities between the white population in the United States and communities of color. Take a look at the numbers. Blacks in Chicago make up 32% of the population, but they account for nearly 56% of all deaths from coronavirus. In Houston, black people make up less than a quarter of the population, but half the deaths. It all comes as minority communities are expressing well-founded fears of being left out of relief efforts. A 2018 Brookings Institution survey shows African Americans have an approval rating of just 29% when it comes to business loans. Joining me now, Andre Perry, David M. Rubenstein Fellow at the Brookings Institution and the author of Know Your Price, Valuing Black Lives and Property in America's Black Cities, and Dr. Andre Campbell, Professor of Surgery at the University of California, San Francisco School of Medicine. Gentlemen, thanks very much for being with me. Dr. Campbell, let me start with you, because those mortality rates from COVID-19, the degree to which they are disproportionate with the population of African Americans, and we've seen similar examples in Chelsea and Boston with Latinos. How do you explain that?
Well, first of all, Ali, thank you so much for having me on. I really appreciate that. I have been absolutely stunned by the disproportionate amount of patients who are being affected and who are actually dying who are African American. Twice the represented rate in the general population. And this, I think, is the result of structural racism, pre-existing conditions, access to care, many of these issues. You talk about Chicago, but it's the same in Milwaukee. It's the same in New York City, my home, where I raised. I've been heartbroken by the tremendous loss. So it is disproportionately affecting African Americans throughout the whole country. In my city that I live in now in San Francisco, it is disproportionately affecting the Latinx population. So this is something that we need to follow, we need to learn about, and we need to make sure that this does not happen again.
And Dr. Perry, this is one of those weird situations where this is half a medical and scientific problem to all Americans and half an economic problem to most Americans. I want to quote from an article which talks to Mirza Baradaran, who you and I know from UC Davis. And the article is called "You're Just Screwed: Why Black-Owned Businesses Are Struggling to Get Coronavirus Relief Loans." The disparity is grounded in a legacy of discriminatory policy. Baradaran points to the systematic exclusion of blacks from government-backed programs such as the GI Bill and Federal Housing Administration loans that allowed white families to build wealth over the course of the 20th century but left black families further behind. She compares the potential for an extinction-level event among black businesses to the higher COVID-19 death rates among black Americans as a result of segregation, economic inequality, and environmental justice. Do you agree with that?
Yes, all of that is correct. Race is not a risk factor. Racism is. And all of those things that were mentioned in that quote are a direct result from policy. The COVID virus does not discriminate, but our past policies have. And therefore, as we move forward, medical professionals must work with social scientists, epidemiologists, to go underneath sort of the medical rationale for why people are contracting the disease and get to the social reasons, the political reasons why people are contracting the disease more. So this is an opportunity for the two Andres, the two Dr. Dre's, to get together and to work out solutions, because the medical field does not train on how to treat racism. That's an area for policymakers.
Dr. Campbell, I think that makes a lot of sense, and I'm glad that the two Dr. Dre's are here with me to discuss this, because you can't really discuss one without the other, right, Dr. Campbell? The idea that minority groups who live in more concentrated environments without adequate access to health care as commonly as the general population are going to get sick more. They're going to get sick more regularly, and they're going to suffer more from those illnesses when they get sick.
That is absolutely right. And I appreciate the fact you're on with two Dr. Dre's, although I think I was the original Dr. Dre. That's okay. But it is tragic what is really happening here. You look at in these communities where people do not have access to care, and because of that, their hypertension may be out of control, their diabetes, their COPD, the incidence of smoking. These are things that we need to study to find out what exactly is why this is happening. So we know that it's disproportionately affecting African Americans, Latinx, and we need to drill down and sort of say, what can we do to fight that? 950,000 people have died because they have got the infection, and 53,000 people have died from it. This is a major tragic thing that is going on, and we need to understand exactly why there's these huge differences between patients.
And Ali, we're going to exacerbate structural inequalities because of this epidemic. It's not just reflecting them. For instance, as was mentioned, business owners, black business owners, are taking a tremendous hit. And we know from the last recession that black businesses did not recover at the same rate as their white peers. So where are the black business owners going to go but a labor market that is racist towards them? And so that just puts us 2 steps back before the next epidemic that will inevitably occur. So we have to work on these structural racism issues as part of a solution moving forward.
With respect to small businesses, black-owned businesses, Dr. Andre Perry, there is a specific problem in that with a lot of these businesses, their banking relationships are not the same as white-owned businesses. They may be smaller businesses which don't have access to the accountants, the CFOs, the lawyers, and the relationships with the banks at which they bank are not necessarily as helpful as some of the biggest banks who are distributing this PPP money.
Absolutely. And we know that the CDFIs, the community development financial institutions, the black-owned banks, they're into high-touch, very intimate relationships with low volume. And so we have to find a way. If we're going to give money to big banks, then those big banks need to build capacity of those smaller banks. It's particularly fintech companies can lend their technological support to smaller banks or banks that have credibility and a good track record with black and brown business owners. And so we've got to involve or have a racial equity lens when we're distributing these funds, or again, the Ruth Chris restaurants of the world will get the majority of the money. And we know that nothing improves without investment. And so we need investment in black businesses moving forward.
And we need to understand this conversation the way you two have helped us understand it, that it's neither one nor the other of these things. It's both. So to the two Dr. Dre's, my gratitude to you, Dr. Andre Campbell, professor of surgery at the University of California, San Francisco School of Medicine, Dr. Andre Perry, the David M. Rubenstein Fellow at the Brookings Institution and author of Know Your Price, Valuing Black Lives and Property in America's Black Cities.